So again, that has to do with not only the scope of what you address in practice, which can be incredibly broad-based. We tend to think in terms of a medical model and are very, very good at thinking about what's wrong, asking parents and family about fever or other problems and preparing them and what to do in those instances. But as much as thinking has evolved to some level to recognize that shift to community, pediatrics, to social determinants of health, it sometimes takes a little extra effort to think about and maximize the impact that your clinical setting can have. Now, you understand that we have very unique access to children and families, certainly from the prenatal to 5 age, but then even onward. So many countries have systems of early childhood that include home visiting systems or really sort of universal preschool systems. We lack that in this country in a universal sense, and even though there are very real issues around access to health care that are experienced by children and families, the truth is 97% of children and families in this country between birth and 5 have very regular interface with some medical provider. So you are in a unique position that you may be like the one trusted professional that really can reach out to and support children and families with a variety of screens, with a variety of educational support, with a variety of linkages to other community resources. And so are we maximizing that potential? That would include maximizing every moment that that clinical encounter has to offer. So I like to think of that from the minute a person interfaces with your practice or your whatever setting you're in. How does your website look? What's the communication pre-visit in terms of phone, in terms of outreach via written or email materials? Once they physically hit your clinical setting, what is that time looking like? Oftentimes, waiting room time, interactions with registrar and administrative staff, or triage can be really creatively tapped into to contribute to the education and support and prevention and screening of children and families. There are some very wonderful models where innovative screening efforts that start pre-visit or that are initiated in the waiting room, modeling proper play or discipline or streaming educational modules about really essential information, pamphlets, posters, all sorts of ways to transform that waiting room. How is every professional and paraprofessional in your clinical setting being tapped into as part of the team to contribute to the care? So again, your moments with that patient are essential, and we really want to think about how you use them, what you address during them, but we want you to think even more broadly about the clinical encounter. So not only in terms of process, what things are you offering, screenings, education, what's the scope of issues that you address in clinic? Are you touching upon issues such as violence, such as early literacy, such as linkages with quality child care? It's limitless, such as smoking cessation and social emotional health. It's really limitless. And the truth is that so many of these issues have an incredible impact on child health. And so you will have the opportunity to look at all of the project work plans, regardless of which one you have chosen, and see demonstrated how there can be really meaningful outcomes on that clinical level, really about any topic that's near and dear to you. And so while we're so excited about your impending contribution to a particular project here, part of our goal of this rotation is to make you understand that whatever your interest area is, there will be opportunities to really think more broadly and transform the clinical venue to address that in a better and a different way, including linkages to the community. The next level of advocacy is the community level, which we really define as anything that impacts a group of individuals, a group of people. A community, some people think instinctively of a geographic community, and that certainly is an example of a community. But communities can take on many different descriptions. They could be an ethnic community. They could be a community of children or families with a particular risk factor, whether it's obese children or children of substance abusing, parents. Again, sort of limitless. And so where are the opportunities to impact a broad number of folks? Can that be, for example, working very closely with a community organization by serving on the board and really impacting policies at a local, daycare center or early Head Start, starting a health promotion initiative in your community, working to create health fair and educational campaign, working with your school's PTA, really forming partnerships with groups of folks. Another example of this we put into this area is actually educating the media, because media have communities of subscribers. So when you educate the media or obtain a media presence, you are therefore reaching out to groups and communities of people. And so this has to do with actually, in some cases, stepping outside the clinical wall. So calling yourself to task to do some things that you may not have conceptualized as your traditional clinical role, as a teacher of a large group, as an innovative contributor to an education campaign, speaking and writing for and with the media. And also, sort of in between that clinical and community piece, is that essential opportunity to link children and families with community-based organizations. And so part of that is developing meaningful relationships with the community-based organizations to understand what they have to offer, and then to understand where your contribution to them may be. Are there opportunities even to sort of have folks from community-based organizations participate in your clinics and do some direct education of residents? Are there really wonderful opportunities for you to refer and link patients and families to a variety of other community resources? How well do you know your community, and how much are you participating in that? Within your rotation, there are education of a group of individuals is an example of community advocacy in action. And so there are built-in opportunities during your rotation to do that. At the Early Head Start Center, giving a class, educating your colleagues is another opportunity to influence a community, because they each have access to large growing numbers of patients and families. So when you educate and empower them around your issue, you are therefore reaching a larger group of individuals. The next level of advocacy is the policy level. Sometimes we think of that more traditionally when we think of advocacy. This, from a lot of other experiences that I have, is the area where physicians are often the least comfortable. And sometimes they say, wait, I don't know how to talk with policymakers, or I don't really understand the whole legislative process. But you don't have to. That's what's so exciting. Folks are so grateful to have that sort of empowered voice of a physician to contribute to an ongoing advocacy effort, that if you just want to lend your voice to do something as simple as writing a letter to an elected official, to emailing them, to calling them, to setting up a visit with them, to really generating testimony to weigh in on a particular bill, to much more engaged opportunities like participating in statewide or federal coalitions on, for example, Medicaid redesign or early childhood systems building. The possibilities are limitless, but the truth is that there are myriad opportunities to influence the policies that influence children and families. This can, for example, be around advocating for particular funding streams, and your voice is particularly credible. It can have to do with issues of ensuring the oversight of particular regulations. And again, your specific, unique voice is particularly welcomed in that area. It can have to do with actually proposing new legislation around safety or helmet use, or again, it's really limitless. But with the power of the internet, one of the key principles of advocacy, and this is not only at the policy level, this is certainly true at the community and the clinical level, is that we don't want you to reinvent the wheel. Collaboration is so essential, and we don't want you to spend time creating, for example, a brochure that's already out there, or maybe simply needs to be mildly tweaked to be relevant to your community. We don't want you to start from ground zero, having to discern the entire legislative process, but most often there are collaborations or coalitions really focused on an issue area that's important to you. And if there are not, there are very exciting ways for you to reach out to people and to sort of engage them. And again, that's an area where your voice as a physician is particularly valuable and important. And you will have the opportunity to choose within your project area if you're particularly interested in working on the policy level. We have done a variety of things like created great two-page documents that we've shared broadly with legislative officials to advocate for issues of funding and reimbursements for particular screens, for advocating for particular environments that are promoting of health and preventing of obesity within school systems, etc., for looking at and trying to work to advocate for reimbursement and addressing and supporting issues for patients of limited English proficiency. So again, it's really quite limitless what your opportunities are, and I think it's that demystification and this understanding that there are a lot of ways that your voice can be very powerful without being an expert on the entire legislative process. So with that said, we're really looking forward to this rotation. You should spend the first day really understanding your schedule, reading through your curriculum and understanding the goals and objectives. Your site visits now are in general set up for you, but you should confirm that they're all set up and you know where to be when, and reach out to Dr. Gordon or I if there's any questions about that. And this beginning week, we want you to really, we want to solidify your work plan for your 2 or 3 rotations. And so what we'll have you do is look at the broad work plan for your project that you have chosen, which would be either the obesity prevention health promotion project, the early childhood medical home project, or the cultural competency project. And focus in on one of the lines or the areas within that project. So as much as we have you contributing to a broader project, we want you each to choose an area that will have a beginning, a middle, and an end. So that gives you that balance of being able to know that your contribution will have sustainability, will have next steps, will get disseminated, but at the same time that you are really able to sort of own a small piece of that, and we'll work with you. But one of the skills that we want you to develop is the skills to develop your own work plan. Now, what's a work plan? A work plan is simply a list. It's sort of your to-do list that you create every day for yourself on the wards or, perhaps just in your day-to-day life. But it's a little bit more formal. On the line items of the general project work plan, you might have a particular outcome listed. So that might be share information about early learning opportunities in the community in a clinical practice. And so how would you go about doing that? You may need to identify or create a brochure around this topic. You may need to follow up and establish relationships with community partners so that you very much understand the process of what's available in the community, and then work within your own clinical system to ensure that this information is shared in a regular way. Is a brochure available in the waiting room? How is it going to be replenished? Are we also asking that particular folks in that clinical setting do a particular screen or share very specific information or questions to the patient and family to bring up this topic area? How will you know that this is accomplished? So those action items that you may need to do to achieve your contribution to the project should all sort of have measurable outcomes. So what's the end product, so to speak? So I will create a brochure and you will put that sort of at the end of your to-do list around that. I will disseminate X number of brochures. We want things that are very concrete, very measurable, and things that really reflect your unique contribution. They should also have deadlines tagged with them by what date. And we want you to be very realistic with yourself. As much as we really want these projects to move, we understand that you are, have 2 weeks out of the 3 weeks that are actually days, and that your time is also experienced with site visits as well. So we want you to create a vision during your first week of the whole rotation that includes your work plan for the several rotations that you have, so that you can just start working immediately after we agree upon the work plan, but that you will be able to accomplish this realistically within your time. If another resident so chooses to also be particularly interested in that area of your project, we haven't yet decided to